Please summarize your chosen approach to family therapy.
My chosen approach to family therapy is solution-focused family therapy. I use this approach as a frame to my work with individuals and families in therapy. This approach is a goal-oriented approach that, as the name suggests, focuses on finding solutions to challenges rather than the problem. This approach is based on over 20 years of clinical studies and research. It was originally founded by Dr. Stephen DeShazer and Insoo Kim Berg and other colleagues in Milwaukee during the 1970s. The approach was developed in an inner-city outpatient medical clinic. The developers of this approach spent hundreds of hours over the course of several years observing therapy sessions. They observed the questions asked, the behaviors, the emotions, and followed the outcome of therapy. Based on the treatment they received, what they found were several patterns that affected change within the session that they used to form the approach of solution-focused therapy.
What makes your chosen approach distinct from other approaches to family therapy?
The thing that distinguishes solution-focused therapy from other approaches is that it is brief in nature and that it is research-proven, goal-oriented approach that works if clients are willing to change. Solution-focused brief therapy differs from traditional treatment in that traditional treatment focuses on exploring problematic feelings, cognitions, behaviors, and/or interactions, and they provide interpretations, confrontations, and then client education. With solution-focused therapy, it helps clients develop a desired vision of the future wherein the problem is solved and explored. They then amplify the related client exceptions, their strengths, their resources to construct a client-specific way of making the vision a reality. I believe that the focus on the present and future rather than dwelling on the past is the biggest difference between this approach and most of the other approaches in the counseling.
What drew you to this approach personally?
I initially thought that my approach to therapy would be cognitive behavioral therapy. I like this approach because it made sense that our thoughts and behaviors are tied to one another, and by changing the way we think about things, we can also change our behaviors. However, I was personally drawn to solution-focused therapy because it's brief in nature. I would have to say the first reason is that it did not focus on past problems that are oftentimes out of the client's control. It looked for many of the strengths of the clients, exceptions to the problems, the desired end state, and the development of the client's plan to achieve the goal. Another reason for choosing this approach is that it is one that I became comfortable with during my work with clients during practicum. This approach is one that I feel is somewhat easier for a new counselor to grasp and apply. I guess my third reason is that most insurance companies, which is probably the way most counselors get paid, prefer this approach. So based on research conducted on this approach, solution-focused therapy or brief therapy is known to provide effective treatment in a short period of time. It is an approach that can be used with almost every situation, to include drug abuse with a combination of motivational interviewing, in order to provide effective results. Lastly, I like this approach because of the key interventions associated with it.
Can you give a case example in which this approach proved to be useful and describe how it was useful?
Well, I would like to capitalize on some of the key interventions associated with this approach. Some of the key interventions used with this approach are signature questions that solution-focused therapy is known for. And I will come back to your question, but the signature questions used in solution-focused interviews are intended to set up a therapeutic process wherein practitioners listen for and absorb clients' words and meanings. This is combined with compliments that encourage the client to continue to do what is working and allows them to focus on their strengths regarding what is important to clients, what they want, and related successes. Then formulate and answer the next question by connecting the clients to those key words and phrases. Therapists then continue to listen and absorb as clients again answer from their frames of reference and once again formulate and ask the next question by similarly connecting with the client's responses. It is through this continued process of listening, absorbing, connecting, and clients responding that practitioners and clients together co-construct new altered meanings that build towards solutions. This approach begins with the therapist taking a positive stance towards therapy sessions that is hopeful that the client will reach their goals. This approach does not directly challenge or confront the client, but through a series of questions allows them to confront the problem. The client is viewed as the expert, and the therapist walks with the client during the therapeutic process one step behind as the client is guided through a series of questions that leads them to find their own solutions and their challenges. The therapist then begins to ask questions that look for previous solutions and exceptions to challenges they have faced in the past. A previous solution being something they have tried in the past that worked, but they stopped doing it because of an exception, and being a time when something occurred other than the problem or the challenge. The therapist at this point in the therapy session would ask the miracle question. And what the miracle question is a way for the client to envision not having the problem and to begin to think of their life without it. It would sound something like, I'm going to ask you a rather strange question. The strange question is this. After we talk, you go back to your work, your home, school, whatever, and you will do whatever you need to do for the rest of your day, such as taking care of the children, cooking dinner, watching TV, giving the kids their bath, and so on. And later on, it'll become time to go to bed. Everybody in your household is quiet, and you're sleeping in peace. And in the middle of the night, a miracle happens. And the problem that prompted you to talk to me today is solved. But because this happens while you're sleeping, you have no way of knowing that there was an overnight miracle that solved the problem. So when you wake up tomorrow, what might be that small change that occurred that lets you know the miracle happened? Now, once the counselor has determined what they are in counseling for, and scaling questions are another way, a signature part of solution-focused therapy. Scaling questions are a quick way to assess the client's level of distress. This is done in the initial stage to determine the changes that have been made from the time of the initial phone call for counseling, and it states the worst it's been ever in the ideal situation they would like to see happen. Question that can be asked on a scale of 1 to 10, with 10 being the best thing that's ever happened, and with 0 or 1 being the worst. What would you rate things when you made this initial phone call? Now today on the same scale, on a scale of 10 being the highest, 0 or 1 being the lowest, how would you rate yourself today? What's different today that made things better or made them worse? How were you able to overcome that? This tool can be used throughout therapy to assess how things are going and why. Another tool is coping questions. And coping questions are used when things don't seem to be better. The therapist, again, attempts to build on the strengths by asking questions such as, how have you managed to prevent the problem from getting any worse? Or, how have you managed to cope with this difficult situation so far? Another thing that's also used in other therapy models are experiments and homework. And experiments and homework are ways that help accelerate the therapy session. Rather than direct the client to do it, however, clients are encouraged to come up with something they can do different to see if it makes a difference in their problem. By having the client come up with their own homework, the likelihood of success and them doing it is more possible.
How would you describe this approach in one sentence?
The the way I would describe this approach from other approaches in one sentence is solution-focused therapy is a research-proven, short-term, solution and goal-oriented approach in counseling that is effective.